Hi, my name is Devon Kollmyer. I'm a second year medical student at Comp Northwest, and I did my project with Dr. Edie Sperling, also at Comp Northwest. My project is called The Prevalence of Co-Morbidities Associated with Median Arcuate Ligament Syndrome, or MALS. So what exactly is MALS? It's actually a fairly rare disorder that occurs when the celiac artery and the celiac nerves are compressed by the median arcuate ligament. Some symptoms can include significant postprandial abdominal pain, weight loss, nausea, and vomiting. There hasn't been a lot of research done for MALS and its comorbid conditions because it's so rare. However, there have been previous studies that looked at gastroparesis, Ehlers-Danlos syndrome, postural orthostatic tachycardia syndrome, or POTS, and psychiatric diagnoses. And these studies found that those conditions often co-occurred with MALS at a much higher rate than it did in the general population. So what we wanted to do for our study is that we looked at a larger sample size of 242 self-identified MALS patients, and we looked at those four conditions in addition to mast cell activation syndrome, or MCAS, autoimmune conditions, and small intestinal bacterial overgrowth, or SIBO. And what we found is that these conditions had a much higher prevalence in patients with MALS as compared to the general population. So what this means is that people who have a diagnosis of MALS, it often takes them years to get diagnosed. So providers can look at these other conditions that often occur and maybe look into MALS as a possible diagnosis. And it may also help patients who are diagnosed with MALS look into other conditions that may co-occur with their disease. So thank you so much for allowing me to talk to you today. Please reach out if you have any questions, and I appreciate your consideration of my project. Thank you.